Have you ever wondered whether a medication you've been taking for years could quietly be affecting your memory? Most people assume that if a medicine has been prescribed by a healthcare professional or sold over the counter, it must be completely harmless when it comes to the brain. But the reality is a little more complicated. Some medications can interfere with the way brain cells communicate, reduce blood flow to the brain, increase confusion, or worsen memory problems, especially in older adults. Imagine noticing that you're forgetting names more often, misplacing everyday items, or struggling to remember why you walked into a room. For many people, these changes immediately raise fears about dementia. While memory problems should always be taken seriously, it's important to understand that not every episode of forgetfulness is caused by permanent brain disease. In some cases, the medications a person takes every day may contribute to confusion, slower thinking, or memory difficulties. This doesn't mean the medications are harmful for everyone, nor does it mean they inevitably lead to dementia. Instead, it highlights the importance of understanding how certain drugs can influence brain function, particularly as we age. The brain depends on a delicate balance of chemical messengers, healthy blood circulation, and efficient communication between billions of nerve cells. Certain medications can temporarily disrupt these processes. Some reduce the activity of neurotransmitters involved in learning and memory, while others may cause drowsiness that makes it harder to concentrate or store new information. When the brain isn't functioning at its best, even routine tasks such as remembering appointments, following conversations, or making decisions can become more difficult. One of the biggest misconceptions is that medication-related memory problems in dementia are exactly the same. In reality, they are often very different. Dementia is generally a progressive condition in which brain function declines over time due to diseases that damage brain cells. Medication-related cognitive impairment, on the other hand, may develop after starting a new drug, increasing the dose of an existing one, or combining several medications with similar side effects. In many situations, these symptoms improve once the medication is adjusted under the supervision of a healthcare professional. That is why doctors often review a patient's medication list when new memory concerns appear. Age plays a significant role in how the body responds to medications. As people grow older, the liver and kidneys become less efficient at processing and eliminating drugs. This means medications may remain in the body longer, producing stronger or longer-lasting effects than originally intended. At the same time, many older adults take multiple prescriptions for conditions such as high blood pressure, diabetes, arthritis, allergies, or sleep problems. Even if each medication is appropriate on its own, the combination can sometimes increase the likelihood of confusion or memory changes. Another important concept is the cumulative effect of medications. A single medicine may have only a mild impact on thinking, but when several medications with similar side effects are taken together, their combined influence on the brain can become much greater. This is especially true for drugs that cause sedation or interfere with chemical messengers responsible for attention and memory. Because of this, healthcare providers regularly evaluate whether every medication is still necessary or whether safer alternatives may be available. It's equally important to keep these findings in perspective. Many of the medications we'll discuss have helped millions of people manage chronic illnesses, relieve pain, improve sleep, or treat serious medical conditions. For many patients, the benefits clearly outweigh the potential risks. The goal is not to create unnecessary fear or encourage anyone to stop taking prescribed medicine without medical advice. Abruptly discontinuing certain medications can lead to withdrawal symptoms, worsening illness, or other serious health complications. Instead, think of this discussion as an opportunity to become a more informed participant in your own healthcare. If you or a loved one has experienced new memory problems, increased confusion, or difficulty concentrating after starting a medication or changing a dose, it's worth having a conversation with your doctor or pharmacist. Sometimes a small adjustment, a lower dose, or a different medication can make a meaningful difference while still effectively treating the original condition. Understanding this connection is the first step toward protecting both your overall health and your long-term cognitive well-being. Let's begin with one of the most commonly overlooked medications that may affect memory and thinking: certain over-the-counter sleep aids. Many people assume that because these products are available without a prescription, they must be completely safe for long-term use. However, several popular nighttime sleep medications contain antihistamines, such as diphenhydramine, which can have a significant impact on the brain, particularly in older adults. While these medications may help someone fall asleep more quickly, they can also interfere with the brain's normal communication pathways, leaving some people feeling groggy, forgetful, or mentally slower the following day. One reason these medications raise concern is that they block the action of acetylcholine, an important neurotransmitter involved in learning, memory, and attention. When acetylcholine activity is reduced, the brain may struggle to form new memories or process information as efficiently. Younger adults often recover from these effects relatively quickly, but older adults tend to be much more sensitive. As we age, natural acetylcholine levels gradually decline, making the brain more vulnerable to medications that further reduce this essential chemical messenger. Research has shown that repeated exposure to medications with strong anticholinergic properties may be associated with an increased risk of cognitive decline over time. While scientists continue to investigate whether these medications directly contribute to dementia or simply reveal underlying problems in vulnerable individuals, the evidence is strong enough that many medical organizations encourage caution, especially for people over the age of 65. Another medication category that deserves attention includes certain prescription drugs used to treat an overactive bladder or urinary incontinence. These medications can be extremely helpful for reducing frequent urination and improving quality of life. Unfortunately, many of them work by blocking the same acetylcholine receptors that are essential for healthy brain function. As a result, some individuals may notice increasing forgetfulness, difficulty concentrating, or episodes of confusion after starting treatment. The challenge is that these symptoms often develop gradually. Instead of a dramatic change overnight, someone may slowly become more forgetful over several weeks or months. Family members might notice repeated questions, misplaced belongings, forgotten appointments, or unusual difficulty following conversations. Because these changes can resemble the early stages of dementia, they may easily be mistaken for normal aging unless the medication list is carefully reviewed. The third group includes first-generation allergy medications, which are still widely available in pharmacies around the world. While they are highly effective at relieving sneezing, itching, and runny noses, many older antihistamines readily cross into the brain and produce drowsiness, along with reduced mental sharpness. People sometimes take these medications for seasonal allergies, skin itching, motion sickness, or even as sleep aids without realizing they share similar effects on memory and thinking. Fortunately, newer allergy medications are generally much less likely to enter the brain and therefore tend to cause fewer cognitive side effects. This doesn't mean everyone should immediately switch medications, but it does highlight the importance of discussing options with a healthcare provider, particularly if memory concerns have recently appeared. If you or a loved one experiences increasing confusion, excessive daytime sleepiness, slower thinking, difficulty remembering recent events, or trouble concentrating after starting one of these medications, it's important not to ignore these symptoms. Rather than stopping the medication suddenly, schedule a medication review with your physician or pharmacist. They can evaluate whether the symptoms may be medication-related, determine if the current treatment remains the best choice, and recommend safer alternatives when appropriate. In many cases, a thoughtful adjustment can improve both symptom control and cognitive function, helping protect long-term brain health while continuing to address the original medical condition effectively. As we continue down the list, it's time to look at 3 additional medications that are widely prescribed and highly effective for many medical conditions, but may also influence memory and cognitive function in certain individuals. These include benzodiazepines, opioid pain medications, and some older antidepressants with strong anticholinergic effects. It's important to remember that these medications can play a valuable role in treating serious health conditions. The goal is not to discourage their appropriate use, but to understand how they may affect the brain, particularly when used for long periods, at higher doses, or in combination with other medications. One of the most well-known groups is benzodiazepines, medications commonly prescribed for anxiety, panic attacks, muscle spasms, and insomnia. They work by enhancing the activity of a calming neurotransmitter called GABA, which slows brain activity and helps reduce anxiety or promote sleep. While this effect can be very beneficial in the short term, it can also reduce alertness, slow reaction times, and interfere with the brain's ability to form new memories. Many people taking these medications report feeling mentally foggy, having trouble concentrating, or forgetting conversations that occurred only a short time earlier. The risk tends to increase with long-term use. Some studies have found an association between prolonged benzodiazepine use and a higher likelihood of cognitive decline later in life, although researchers continue to debate whether the medication itself is responsible or whether the underlying conditions, such as chronic anxiety or sleep disorders, also contribute. Regardless of the exact cause, many medical guidelines recommend using these medications for the shortest duration necessary and regularly reassessing whether they are still needed. Next are opioid pain medications, which are often prescribed after surgery, serious injuries, or for chronic pain conditions. These medications can provide significant relief when other treatments are insufficient. However, opioids also affect areas of the brain responsible for attention, memory, and decision-making. They may cause drowsiness, slower thinking, reduced concentration, and confusion, especially when treatment begins or when the dosage is increased. Older adults are particularly sensitive to these effects because aging changes the way the body processes medications. Reduced kidney and liver function can cause opioids to remain in the body longer, increasing the likelihood of side effects. In addition, combining opioids with sleep medications, anti-anxiety drugs, or alcohol can further impair brain function and substantially raise the risk of falls, accidents, and episodes of severe confusion. Another category worth discussing includes certain older antidepressants known as tricyclic antidepressants. Although these medications remain effective for depression and are also prescribed for chronic nerve pain, migraines, and some sleep disorders, many have strong anticholinergic properties. As discussed earlier, acetylcholine is essential for learning and memory. Blocking this important neurotransmitter can lead to forgetfulness, difficulty focusing, slower mental processing, and increased confusion, particularly in older adults. It's also important to recognize that not all antidepressants carry the same level of risk. Many newer antidepressants have far fewer anticholinergic effects and are generally considered better options for older patients when appropriate. The choice of medication depends on a person's overall health, medical history, and individual response to treatment, which is why these decisions should always be made in partnership with a healthcare provider. If memory problems, unusual confusion, excessive sleepiness, or difficulty thinking clearly develop after starting one of these medications or after a dosage change, it's important to report these symptoms promptly. A healthcare professional can evaluate whether the medication may be contributing, consider dose adjustments, recommend alternative treatments if appropriate, or identify other medical conditions that may be affecting cognitive function. Regular medication reviews become increasingly valuable with age, helping ensure that every prescription continues to provide more benefit than risk while supporting both physical health and long-term brain function. Now let's examine the final 3 medications on our list. These drugs are commonly prescribed for important medical conditions, and many people take them safely for years. However, research has suggested that under certain circumstances they may be associated with memory problems or cognitive decline, particularly in older adults or those taking multiple medications. It's important to remember that an association does not necessarily mean these medications directly cause dementia. In many cases, the underlying health condition being treated may also play a role. The key is understanding the potential risks while recognizing that these medications may still be the best option for many patients. One category that has received considerable attention is proton pump inhibitors, often called PPIs. These medications are widely used to treat acid reflux, stomach ulcers, and gastroesophageal reflux disease. They can be extremely effective at reducing stomach acid and preventing complications such as bleeding ulcers. However, some observational studies have suggested that long-term use of PPIs may be linked with an increased risk of cognitive decline. Scientists are still investigating this relationship, and the evidence remains mixed. Some studies have found a possible connection, while others have found little or no increased risk. Researchers have proposed several possible explanations. Long-term suppression of stomach acid may reduce the body's ability to absorb certain nutrients, including vitamin B12 and magnesium. Vitamin B12 is essential for healthy nerve function, and low levels can contribute to memory problems, numbness, fatigue, and difficulty concentrating. This does not mean everyone taking a PPI will develop a deficiency, but it highlights the importance of using the lowest effective dose for the shortest appropriate duration and having regular medical follow-up when long-term treatment is necessary. The next group includes certain anti-seizure medications. These drugs are prescribed not only for epilepsy but also for chronic nerve pain, migraines, and several other neurological conditions. Because they work by reducing excessive electrical activity in the brain, they can sometimes slow normal brain processing as well. Some people notice difficulty finding words, slower thinking, reduced attention, or mild memory problems, especially when beginning treatment or increasing the dose. These effects vary greatly depending on the specific medication and the individual taking it. Many people experience no noticeable cognitive changes, while others may be more sensitive. Doctors carefully balance seizure control or pain relief against potential side effects and may adjust the dosage or choose a different medication if cognitive symptoms become troublesome. Abruptly stopping anti-seizure medications can be dangerous and may trigger serious seizures, so any changes should always be made under medical supervision. The final category includes certain medications used to treat Parkinson's disease and other conditions that affect dopamine activity in the brain. These medicines can significantly improve movement, reduce stiffness, and enhance quality of life. However, because they alter brain chemistry, some individuals, particularly older adults or those with existing cognitive impairment, may develop confusion, hallucinations, or worsening memory problems. These side effects are more likely at higher doses or as the disease itself progresses, making regular follow-up with a neurologist especially important. What all of these medications have in common is that they are often medically necessary. Stopping them without professional guidance could result in worsening disease, serious complications, or even life-threatening consequences. Instead, the safest approach is to stay informed, report any new memory changes promptly, and schedule regular medication reviews with your healthcare provider. If cognitive symptoms appear, your doctor can evaluate whether the medication, the underlying illness, nutritional deficiencies, or another medical condition may be responsible. In many cases, careful adjustments, monitoring, or alternative treatment options can help preserve both physical health and cognitive function, allowing patients to continue receiving the benefits of treatment while minimizing unnecessary risks to the brain. Not everyone who takes these medications will experience memory problems, and many people use them for years without noticing any changes in their thinking. However, some individuals are more vulnerable than others, making it especially important to recognize who may be at greater risk and what warning signs should never be ignored. Understanding these risk factors can help identify problems early, allowing healthcare providers to make adjustments before symptoms become more serious. One of the biggest risk factors is age. As we grow older, our bodies process medications differently. The kidneys and liver, which are responsible for removing many drugs from the body, gradually become less efficient. As a result, medications may remain in the bloodstream longer than expected, increasing both their effectiveness and their side effects. The brain also becomes more sensitive to medications that cause drowsiness or interfere with important neurotransmitters involved in memory and attention. This is one reason why a dose that is well tolerated by a younger adult may produce confusion or excessive sleepiness in someone over the age of 65. Another major concern is taking multiple medications at the same time, a situation often referred to as polypharmacy. Many older adults take prescriptions for high blood pressure, diabetes, cholesterol, arthritis, allergies, acid reflux, sleep problems, and chronic pain. While each medication may be appropriate on its own, the combination can increase the likelihood of drug interactions and amplify side effects that affect the brain. Two medications that each cause mild drowsiness, for example, may together lead to significant confusion or difficulty concentrating. People with reduced kidney or liver function also face a higher risk because their bodies may not eliminate medications as efficiently. Even standard doses can build up over time, producing stronger effects than intended. Dehydration, which is common among older adults, can make this problem even worse. Something as simple as not drinking enough water during hot weather or while recovering from an illness can increase medication levels in the body and contribute to sudden confusion. Existing memory problems or neurological conditions may also increase vulnerability. Someone with mild cognitive impairment, Parkinson's disease, or a history of stroke may have less reserve to compensate for medications that affect brain function. In these individuals, even small changes in medication can sometimes lead to noticeable declines in memory, attention, or daily functioning. Recognizing the warning signs is equally important. One of the earliest symptoms may be increasing forgetfulness that seems different from normal aging. A person may repeatedly ask the same questions, forget recent conversations, or struggle to remember appointments despite using reminders. Others may notice difficulty concentrating while reading, following television programs, or participating in conversations. Tasks that once felt simple, such as managing finances, preparing meals, or taking medications correctly, may suddenly become more challenging. Confusion is another important warning sign. Someone may become disoriented in familiar places, have trouble following instructions, or appear unusually sleepy during the day. Family members might notice personality changes, increased irritability, poor judgment, or a lack of interest in activities they once enjoyed. In some cases, individuals may experience dizziness, unsteady walking, or frequent falls, which can also be linked to medications affecting the brain. If any of these symptoms develop, don't assume they are simply a normal part of aging. Instead, schedule a medication review with your healthcare provider or pharmacist. Bring an up-to-date list of every prescription medication, over-the-counter product, vitamin, and herbal supplement you take. A careful review can sometimes identify medications that may be contributing to cognitive symptoms. Allowing your healthcare team to adjust doses, recommend safer alternatives, or investigate other possible causes. Early recognition and timely intervention can make a significant difference in protecting memory, maintaining independence, and supporting long-term brain health. Protecting your brain doesn't necessarily mean avoiding medications altogether. In fact, many medications are essential for controlling chronic diseases, preventing serious complications, and improving quality of life. The goal is to use medications wisely while adopting healthy habits that support long-term cognitive function. Small, consistent choices made each day can have a meaningful impact on brain health and may help reduce the likelihood of medication-related cognitive problems. One of the most important steps is to schedule regular medication reviews with your healthcare provider or pharmacist. At least once a year, or whenever a new medication is added, ask whether every prescription is still necessary, whether the current dose is appropriate, and whether there are newer options with fewer cognitive side effects. It's also helpful to mention any over-the-counter medicines, herbal supplements, or vitamins you take, since these can interact with prescription medications in unexpected ways. Many people are surprised to learn that some non-prescription sleep aids, allergy medicines, or cold remedies can contribute to memory problems when used regularly. Keeping an updated medication list is another simple but powerful habit. Write down the name of each medication, the dosage, how often you take it, and why it was prescribed. Bring this list to every medical appointment, especially if you see multiple specialists. This helps prevent duplicate prescriptions and allows each healthcare provider to recognize combinations that may increase the risk of confusion or cognitive impairment. Lifestyle choices also play a critical role in maintaining brain health. Regular physical activity improves blood flow to the brain, supports healthy blood vessels, and encourages the growth of new connections between brain cells. Even moderate exercise, such as brisk walking, cycling, swimming, or gentle strength training, can provide significant benefits when performed consistently. Experts often recommend aiming for at least 150 minutes of moderate physical activity each week, adjusted to your individual abilities and medical conditions. Nutrition is equally important. A diet rich in colorful vegetables, fruits, whole grains, beans, nuts, seeds, and healthy fats provides the brain with the nutrients it needs to function efficiently. Foods rich in omega-3 fatty acids, such as salmon, sardines, trout, and walnuts, may support brain health, while limiting highly processed foods, excessive sugar, and saturated fats can help reduce inflammation and support healthy blood vessels. Staying well hydrated is another simple but often overlooked strategy, as even mild dehydration can contribute to fatigue, confusion, and difficulty concentrating. Quality sleep should never be underestimated. During deep sleep, the brain organizes memories, restores nerve cells, and clears waste products that accumulate throughout the day. If sleep problems become persistent, discuss them with your healthcare provider instead of relying on over-the-counter sleep medications for long periods. Addressing the underlying cause of poor sleep may provide lasting improvement without increasing the risk of cognitive side effects. Keeping the mind active is another valuable way to support cognitive health. Reading, learning a new skill, solving puzzles, playing a musical instrument, or engaging in meaningful conversations all challenge the brain and help maintain mental sharpness. Staying socially connected is just as important, since regular interaction with family, friends, or community groups has been linked to better cognitive health and a lower risk of depression, which itself can affect memory and concentration. Finally, remember that you are an important partner in your own health care. If you notice new forgetfulness, confusion, difficulty concentrating, or changes in thinking after starting a medication or increasing its dose, don't ignore these symptoms and don't stop the medication on your own. Instead, contact your healthcare provider promptly and describe exactly what you've noticed. Early communication allows your medical team to identify whether a medication, an underlying health condition, or another factor may be responsible. With informed decisions, regular monitoring, and healthy daily habits, it is possible to protect your brain while continuing to receive the treatments you need for a longer, healthier, and more independent life.